Good afternoon, everyone. My name is Leandra Tricoros, and I am the Diversity, Equity, and Inclusion Administrator in the Office of Diversity, Equity, and Inclusion. Thank you so much for joining us today for our Lunch and Learn. July is National Minority Mental Health Awareness Month, and we wanted to take the time to discuss the importance of mental health, especially in our communities of color, specifically how to navigate assistance and support, as well as provide insight on barriers and challenges that minority groups encounter when accessing care. I would like to thank the President of our Board of Commissioners, John O'Grady, Commissioner Erica C. Crawley, and Commissioner Kevin L. Blaise for their continuous support, as well as our County Administrator, Kenneth Wilson. I have the great pleasure of introducing Dr. Whitney Raglin Bignall, Associate Clinical Director of the On Our Sleeves Movement for Nationwide Children's Hospital, Dr. Ameena Kemavor, Vice President of Advocacy and Engagement of Alcohol, Drug, and Mental Health Board of Franklin County, also known as ADAMH, and Stephanie Mitchell Hughes, Assistant Director of the National Alliance on Mental Illness, Franklin County, also known as NAMI. Dr. Whitney Raglin Bignall has an expertise in mental health disparities and has a passion for making mental health services equitable for all children and families. Before joining the On Our Sleeves team, Dr. Raglin Bignall played an integral role in working with families at a nationwide children's primary care center, which served a primarily low-income and racially diverse community. She also implemented a program to help enhance parenting skills for raising young children and built partnerships with community organizations, primary care offices, and neighborhood schools. Dr. Ameena Kemavor, also known as Dr. K, is an independently licensed professional clinical counselor with a supervision endorsement in the state of Ohio, who has been working in the field of mental health and community services for over 27 years. Dr. Kemavor began her career providing inpatient psychiatric care to youth and adults and has experience working with persons diagnosed with severe and non-severe mental illnesses and substance abuse disorders. Stephanie Mitchell Hughes is an attorney and mental health disruptor who writes about, speaks, and presents workshops on living with depression, resilience, well-being in the legal profession, and the healthy workplace. Her work primarily appears in online publications, including the Good Men Project and Medium. Welcome, and thank you all so much for taking the time to speak with us today. If we could please get right into the wonderful and important discussion, if you could educate us on what constitutes a mental illness. What does that term mean?
Hi, good afternoon. Thank you so much for the invitation to connect again this year. I really appreciate it. On behalf of our board, I definitely appreciate this opportunity to talk about mental illness. So the way that I like to kind of break down just like what is mental illness, like what does that mean? Really, it's very practical. So not too deeply, clinical would be my response to that, which is it's behaviors that would have the ability to impact significantly some impairment regarding our mood, regarding our thoughts or our cognitions, and then also our behaviors. So the mental health first aid instructor in me breaks that down to say that it is anything that has that ability to significantly impact in a negative way our ability to live, to laugh, and to love.
Amazing. Thank you so much. Anyone
Yielding
else
to my
like
colleagues.
to join?
Well, I 100% agree with what is said. I think it's important to know that we all have symptoms here and there of many things, but it's when we have a lot of them and they are causing us to not function in the way we want to and not live in the right way we want to. So yes, you might not be organized, but that doesn't necessarily mean, for example, that you have a mental illness. So it's important to know that it accounts for lots of different things, and it's definitely getting in the way of you being the best self.
Mm-hmm. Miss Stephanie, I think you're muted.
Okay. All right, I want to take a stab at this as a layperson and based upon my own personal lived 45 plus years experience. I would say that depression, and I call it depression and suicidal ideation, they are the beast. They are the beast. They are like mercury meaning that they can slip through even the tiniest of cracks. They are disruptive. They are messy. They are also the things that remind me of my own imperfections and my own humanity. And so that is what I would say a mental illness is, because they will dog you. In my experience, I used to have a suicide voice that lived in my head, and for every day telling me to end my life. And I had to figure out, in order to function every day, how to either silence that voice, make it smaller and smaller, and try to hide it somewhere so that it just did not continue to dog me and just create so much noise.
Thank you so much. That was so powerful. Appreciate that. If you could please speak to how prevalent is mental illness and what could be common causes of it in children and adults? Are there signs that we should be aware of?
I'll stab first, just because I'll take the kids lens that we know 1 in 5 people will have mental illness. And it starts early. We know that over 50% of that is going to happen before the age of 14. And so it's very prevalent, and it's on a continuum of different kinds of mental illness and disorders. And so it can look very different for many people depending on the experiences they're having. But it is very common. If you think about all of the disorders that are currently there for it to be in our society, and people can have more than just one. And I think it's important to know that.
Yeah, that's real good. I'll add to that by saying, which I noticed in your questions, Leandra, which I really appreciate, is just acknowledging mental illness. I hear a lot of times people say, I don't have a mental health. And the reality is that we all have a mental health, but we may not all have a mental illness. And so making, the defining clarity in that particular space is just as important as knowing all the statistics, that come along with the realities of how mental illness can negatively impact, one's life. I have an anxiety disorder. I've shared that several times, and there's sometimes where my anxiety is literally my superpower. And so, but there are some times where it gets ahead of me, and it really shouldn't. But it does in that regard. And so mental health, everybody has mental illness. Not everyone has, but I really like what Whitney just shared about the severity. Trying not to say too many clinical terms, but maybe like the severity of the symptoms may not be the same every single day, but that doesn't mean that you still are not capable of achieving different things. So yeah, you might have a day that you're, just completely disorganized. And it may that, and in that day, your symptoms, of your mental illness may start to rise, a little bit more to the top on that day, for whatever reason. And so I think that the mental illness is definitely prevalent. Ages, 18 to 25, I think is still that sweet spot. Last time I looked for National Institute of Health regarding the symptoms being a little bit more prevalent or known. But when you think about the ages of 18 to 25, there's a lot of life transition happening in those, particular spaces. And so why wouldn't, underlying mental illness decide to rear, its head in a time like that? So.
Well, there are different stories that I could tell about this, but in terms of the question itself, signs and symptoms. So let me just say, I'm a person, I've lived with a mental illness for a really, really long time. And I know how you can determine whether I am struggling really depends upon my physical living space. Anywhere else, you may not see it or know it, because the longer I've lived with it, I know how to navigate that. But, and this is a big, big but, In 2006, I had a sea change, what I would call a sea changing event. And that sea changing event revealed that I had been deeply, deeply depressed for at least a decade, and I did not know it.
Mm.
And during that time period, someone who is a therapist, when I was going through that upheaval, I had known her for maybe at that point, maybe 6 or 7 years. And she said, when I met you, I thought you are depressed. She's depressed and she doesn't know it. So that meant that I parented my children as a depressed person. I worked as a depressed person. I wasn't missing time from work. I wasn't staying at home and all this other kind of thing. You know, at the time, I was representing children who were, oddly enough, abused and neglected in the mental health, in the child welfare system. And, you know, and even in the state that I was in, I could still pick up on when I see similarities behind my own symptoms and how they manifest. I can see those in other people. By no means am I a clinician, because I'm definitely familiar with the whole thing of not being able to get things organized, not, you know, trying to sort laundry was a problem very, very early on. And I can remember really early in my journey, because for many years, I did not take an antidepressant. I did not have medication or diagnosis. You know, my earliest experience with depression dates back to when I was 15 years old. And I was 15 in 1978. I didn't have language or any of that. So you fast forward all these years later, and I've got this raging depression, and I can't even sort laundry. It's unmedicated, and I'm in really, really bad shape. So I wound up just taking all of the laundry that I had that I was trying to sort and dumped laundry that had already been washed and was wet in with laundry that was dirty in a garbage bag, and just took it to where I was going next and just said, I'll figure it out once I get there. So, I mean, it can show up in just all kinds of ways.
Absolutely.
Mm-hmm. Thank you so much. Thank you. Would you say mental illness affects men and women differently? And do you see what are the trends among different racial demographics?
I can probably jump in, but then obviously chime in with, you know, my colleagues to say that whenever I think about the data or the stats, you know, nationally, globally, when we start talking about gender related factors that are connected to mental illness, the first thing that comes to mind for me is not so much like the difference, but more so that the statistical reality that women just tend to seek help for their mental health. That could or maybe not end in a diagnosis with a mental illness. I don't know, it just depends. But so those are the numbers that that's what we're able to report out, because that's what we received. It does not mean that there are not more men in the community that are suffering from mental illness at a similar or higher rate than women, because when you look at suicide and suicidality, then men are using more lethal means, whereas women are not. And so there's all of these different competing factors that are connected to a question like that. In my multiple years of direct service, I was very client focused and not that clinician that kind of just put a stamp on every client that comes in with depression or with anxiety. You know, you're a male, so you're probably going to do this, or but really getting to know the person as a whole emotional being. And be able to treat them accordingly, and not put too much weight in spaces that would unintentionally, I'm going to say, impede, the significance of having a diagnosis so that one can be able to take ongoing next steps regarding treatment and so forth.
Yeah, I love that response. And I just wanted to add, I work with kids. And so we know that there are just some diagnoses that just from prevalence rates that we're still trying to understand, things such as autism. We just see it in more males at this point, and ADHD too, but that doesn't mean that we don't have girls that have those diagnoses. And sometimes it's because it does look different, and there's a lot of research going out there that says it looks different. And so as a field, we're learning about how it looks different, because we could be missing people. And so I'm cautious to say, the field is always learning and growing and doing research, because things look and change different. Sorry, my lighting, it just keeps changing in this room. And so I think we just have to be aware of that. So right now, a trend might be looking this way, and it might be because we just don't have all the information about it or what makes it that way, when it comes to the gender differences. I also think that we should talk about a little bit about just how in society, how things present, you know what I mean? So I think sometimes there's a little bit more acceptance for women to be more anxious than maybe a male to be. And so it doesn't mean they don't have anxiety. It just means that how they present with their anxiety may look different. And so you might think that they have an anger problem when really they're really anxious and they're trying to avoid it. So I think it's important to know that society sometimes shapes how we express things, but we all might be dealing with things in many different ways. And so I think it's important to know that. And then to know that, society has done a lot when it comes to race and how we are treated and the experiences that we have. And so things such as trauma and discrimination and other things are going to impact how different illnesses may look, and that doesn't necessarily. And so I think that we have to keep all of those factors in mind when we're thinking about it.
Absolutely, excellent points. Thank you.
I was going to say
Stephanie,
something
did
to
you
what
want to
Whitney
say?
said, which is the
Okay.
whole practice thing. As you said, that we're learning and researching and things are evolving. And I've been sharing that for as many years as I can count, which is that we are all practicing. We're practicing, medicine. We're practicing law. We're practicing counseling. We're practicing social work. We're practicing these things. We have great, evidence-based, tools and modalities and all these different things, but we're still practicing because it's not a one-size-fits-all solution for every single person. So I love that I heard you say that.
Right. It's even in the legal profession, we have some of the highest rates of mental illness and substance abuse. At the same time, because of the stigma that's associated with it, it is incredibly difficult sometimes to really get the assistance and the help that you need. That is starting to change. People are taking a much more intentional look at mental health, mental illness, and well-being in the profession, but we do still have a very long way to go, and stigma can play such a huge role in that.
Absolutely, and those are excellent points, and it is a great lead into my next question, is if it's common for mental illnesses to go undiagnosed, and if so, if there's themes among certain racial groups. And I think you've already touched on that, but I would love to do a deeper dig, because I believe you really just nailed it, the stigma that's really embedded within our communities and around, surrounding mental health.
Well, one of the things that I will say is, I've been writing and telling my story and speaking about living with a mental illness since 2013. And what I decided to do was and I'm focused on 3 communities. I'm focused on the African American community, I'm focused on the faith community, and I'm focused on the legal community, because all 3 of them are in denial, in my opinion, about the extent and the presence of mental health and mental illness. And so then what happens is, and you have people who will oftentimes will say, well, from the pulpit all the way out to the parking lot, or from the top of the firm to the bottom of the firm. I know people, lawyers, women lawyers, and Black women lawyers in particular, who have talked about running screaming out of law firms just because the level of the microaggressions, the stress, and all of that carries trauma. And so then people will say, well, I'm not mentally ill. I don't have a mental illness, but they're self-medicating all over the place. People may be self-medicating with drugs. They may be self-medicating, which happens amongst lawyers, unfortunately, sometimes. Some people may be self-medicating with food or shoes or what have you, whatever it is that they can do to dull the pain and to tamp all of that down, to shut all that noise down, engage in self-harm, all to shut down the pain. And so the thing I have said is, I'm just going to jump right in here and do this and say this, because we have to stop pretending that the emperor is wearing clothes. They're not. And we have to stop saying, and this is, and I'm going to just date myself as if I haven't done that already, but I'm in the generation where, as an African American, what goes on in your house, what happens in your family, stays in your family. So I have called mental health within any work that I've done specifically directed at African Americans as the word that cannot be, or the phrase that can never, ever be uttered. And we just have to stop pretending that it does not exist, because that is really the only way that we will heal. So I'll jump off of my soapbox because I'm
No, thank you.
No, I really
Thank
like
you.
that. I like that you said that, because I literally wrote in my note regarding, why don't people, receive help and this whole being undiagnosed. The very first word that I wrote is what you said, Stephanie, which is denial. I am convinced that there are a lot of, us walking around, like you said, self-medicating, that then leads into what? Co-occurring or dual diagnoses and things like that. But the denial, the lack of awareness, I already spoke briefly about that developmental, time span where everything is like really new in your life. And then you're an adult and now you have real responsibilities. And so having worked in college student mental health, what I saw was a lot of just unaware, like I've never felt this way before. What is my body doing? Why is my brain telling me these things? Where negative thoughts? What is that? That's a thing? Oh my gosh, that's happening to me. So just hearing, a lot in that particular space. But if you don't have the awareness, or you're in denial, unfortunately, that could end up leading down to that road of crisis. Right. Everything became so overwhelming, so out of control, so fast, seemingly so fast, even though it may have been building up for a year. It's just the right amount of circumstances. My dad asks me all the time when he sees something on the news, he'll say, Ameena, why did they do that? And I'll be like, well, they're not my client, so I don't really know. But then I also say, we all have a breaking point. The problem with that breaking point is that we also don't know what that is. We can say all day, oh, if that was me, man, that would be my breaking point. But then that happens to you and it really wasn't your breaking point. Right. And for most people, it's never really just one thing that's happening. It's all these things that are happening and they just build up over time. The last thing I was going to say about different communities, and I identify as a Black female, and as a Black woman, yes, all that stuff in the household, what goes on in here stays in here. But we have a lot of different languages in behavioral health: language of mental illness, language of mental health, language of addiction or substance use. And then there's language of community, language of family, and then there's, general just language in general. But the way that symptoms are described, depending on not just your race, not just your socioeconomic status, not just, your gender or any intersectionalities that you may identify with. But inside of all of those, we describe things differently. Oh, I got the shakes. Okay, well, is that anxiety? Oh, my mind is racing all the time. Is that anxiety? Is that hypomania? Could that be manic? You know what I mean? Mania. I mean, could something else be going on? Oh, I've just been living like this, forever. Oh, that's Uncle Joe. Just leave him alone. That's what he does at Thanksgiving. He don't bother nobody. He just been like that for years. And it's like, has anybody thought that Uncle Joe might be suffering though?
Right.
Because what you said, Stephanie, which is true, we don't talk about it.
Exactly.
Yeah. So people are suffering in silence, and I can only speak from, my experience as a Black female in the Black community to say that I know that there's different language used to describe actual mental illness symptoms. But if people do not know how to pick up on those things, then seeking help, I mean, I hope that would
Really
happen at
hard.
some point. Yeah.
I wanted to just add, I agree with all of that. And for the kid and parent perspective is sometimes we do see these symptoms early in a kid's life, but the family's not ready to be there. They're not ready to see it. They don't want that label. And so we ignore it. We just label, we say, well, they're just a bad kid. They don't listen or whatever else. Or we don't want to pay attention to it, or we don't want the school to do this and that. And understandable, like there are challenges there, but we don't get the help. And then when they failed all these years or something really bad has happened, now we're ready to finally, meet with somebody. But this has been years and years of us not acting on it because we're not ready to accept that my child might have this. And listen, as a parent, like nobody wants as a parent for us to like see your child having something, right? So I think it's important to know that part. It is difficult, but there are times when I've had parents say to me, like, what does this kid have to be sad about? Their life is not as bad as mine.
Exactly.
Right? What do they have to be? So the kid could be experiencing something, but we don't want to go there. We don't want to face why they could be feeling that way, and so we might push that away. And so I want to be an advocate for them a little bit, because I do think that sometimes we just talk about adults, but there's littles there who are really struggling. And sometimes they don't have that voice, right, to really be able to say and share. They might have a lot of behaviors you see, but they might not be able to really reflect to you what's really going on with them. So I think that's, one important thing. And the other thing that I think is we talk a lot about in the organization I work is that there's stigma. We have our own stigma, but then there's the stigma about, so you tell someone that you're a kid or you have a mental illness, how do they respond? So if you told everyone that you have cancer, everyone's going to bring you food. They're going to come and they're going to be like thinking about how they can help you. But when you have that mental health disorder, that illness, your child has it, it's silence. Right. Or there's whispering, but there's not that same level of help. And I think, so when we talk about like, why aren't people really ready to like talk about it? It's because it's scary. You don't know what they're going to say. Are they going to just call you a bad mom? Right? Even if you're the best mom, right? So I think it's both ways. We got to think about both things. You know what I mean?
Yeah. Well, and the thing that I have said, and I've said this primarily to legal employers, but I just believe this is true straight across the board. The millennials and the Gen Z, that generation, they are not going to allow us to continue ignoring mental health and mental well-being. They're just not. And I mean, I raised two of them, and one of them, the Gen Z, the rebel, is actually went to law, is in law school right now. Wasn't my idea, it was hers, but they're just not going to tolerate this. And their whole thing with adults and with communities at large is, we have watched you all do this. We've had to suffer because we are children and no one listens to us. We now have, we've just had to take it. Now we don't have to take it. So you're either going to create these spaces for us, these safe spaces for us so that we can discuss and figure out what to do, or we're going to get on the train and you're going to get left. It's not get on the train or get dragged. It's get on the train or get left. And that's basically what they are going to start saying and have been saying in increasing numbers. So it's like, well, you can keep doing this, but if we just stand here for just a few more minutes, you know, it's like, we're going to do this or else.
Absolutely. There's so many amazing points you all made. Thank you so much. And just thinking really the wonderful point of sometimes we forget that children are little people too. So if you can imagine how hard it is as adults that we don't even acknowledge what we're going through,
right? How
can a little person even say that? So it makes so much sense. And I just appreciate all of you pointing that out and connecting that. If you could please speak to those that do seek a diagnosis and once it's reached, it's just overwhelming and scary to even think about what that means, what to do next. Could you please discuss some initial steps to take prior to a diagnosis as well as after? I would think maybe even a pause once you receive the diagnosis, because as you just wonderfully stated, it's not the end all. It's actually an avenue to begin help.
Mm-hmm. Mm-hmm. Mm-hmm.
Dr. K, are you speaking?
Yeah.
Sorry, tech.
Nope,
we're still in this though. No, I was just going to say, I was going to maybe just briefly touch on process and expectations, you know, in that clinical, you know, space and in that role, the before the diagnosis, or maybe like the before the first appointment, if you will, with a clinician, to explore, you know, how you've been doing, feeling, thinking, and all those things. If there is that person that Stephanie has mentioned that you could, you know, talk to, that is confidential, that you actually feel like if I tell you something, then it's not going to, you know, broadcast. I don't even understand how I'm feeling right now. I know that I need help, but I'm sharing this with you because I trust you. I trust you to hear me. I trust you not to blame me. I trust you not to judge me. And so just having, you only need one, just one good person to listen to you and understand you. And that person doesn't always have to be a therapist right out. It might not be. But as you get to that point where you have your initial, we call it an intake, where you do an assessment, we talk about, you know, the presenting problem as to why you're here, and then what triggered you actually coming in today, and then looking at the historical value of who you are as this wonderful emotional being. Then, you know, after that, a diagnosis is rendered. It can be overwhelming if you really never, ever actually thought that you would have a mental illness. Like, what do you mean? Yes, I've been functioning like this for like 15 years, but I didn't know it was this. You know, I just knew I didn't feel that good today, and this is getting worse, and I didn't know what to do. But then I would venture to say, and I would hope, and just in my own experience, that while it is shocking at the beginning that you've taken such a wonderful step to get additional support, and then treatment can get started. Then you really start to learn who you really are and how you engage in your environment and things you should stay away from, and, you know, start learning all those things. So that's the hopeful part of that process. But that was just me trying to give like a general, this is what you can expect. And yes, it can be overwhelming. But if it's not, that's still okay. You're still in a great space because you've reached out for help.
Right. I agree with that. I'll just, again, from my vantage point and my experience, when I first was diagnosed with very, very deep depression in 2006, I didn't have any health insurance. And that's all before the ACA, all of that. So I didn't have any health insurance. And it was my foray into the world of antidepressants, and didn't have any real money to buy. So I was really piecing my care together. And I have a friend who I went to law school with, who has lived with depression and had lived with depression. And so she helped me fill out documents so that I could get my medication, at least initially, for free. I was not fully medicated because I did not have health insurance. There were things that were foreclosed to me. I couldn't go to therapy. I couldn't get a psychiatrist to evaluate my medications. And some of those things I really didn't even know. I knew how to access a therapist. I did not know how to access a psychiatrist.
Mhm.
Fast forward to when I finally got health insurance. And that's when I learned that there's a lack of psychiatrists. And these are the people who, well, they're not the only people who can manage your medications, but a psychiatrist their primary responsibility is to evaluate your medications and to determine whether or not they need to be adjusted. And so I didn't even realize just how complicated having and getting a psychiatrist was going to be. And then eventually I was able to find a psychiatrist who I really liked. And this was maybe about 5 or 6 years in. And I finally was on a medications that were at the proper dosage level. But when she retired, I had another problem of finding another psychiatrist to replace her. And so I went through several years of calling places and saying, you know, do you have any openings, and being told you're going to be on the wait list. I would get frustrated, kind of walk away. Then I'd pick it up later. Then I hit a point where in August of 2016, I hit this point where I had a crisis. And at that point, I knew enough by then to know that I absolutely had to find a psychiatrist. And this is where 988 is really, really important, because I had a therapist, and my therapist at the time said, well, you know, because I was having a hard time. And she's like, well, you know, you can go to the ER and see someone. And I was like, no, can't do that. That's a no-go for me, because I still had one of my children at home. And I don't know how I'm presenting to other people. What if they decide that I'm a danger to myself and others? What if they decide that they're going to keep me? So yes, I'll get my meds, but at what cost? And I cannot and will not leave my child, even though she's in high school, in a situation like that for her to freak out. So didn't do that. And so it took a couple of weeks for me to find a psychiatrist. And you need some support. I did have some support in that. And because I did have health insurance, my health insurer also became involved in helping me to find one. But what I will say is, I know this all sounds like a nightmare, and why would anyone have to go through all of that? It is absolutely positively worth it. It became worth it to me, because I had to look at how I could fully be myself and be myself in a responsible way. So even though there are these obstacles and these hurdles and these challenges, if that means that you can take better care of yourself, you are worth that. So I know that's a long answer, so I apologize, but.
No, that is fantastic. Thank you.
I love that you talked about it, because I think it is a process and it takes lots of steps. And I think in order for people to have their expectations met, it's not one of those easy, quick things when we're talking about treatment. It takes a while sometimes. And I think that that's part of the frustrating process. Sometimes we just want to take one pill and it's all better, or we want to have one visit with a therapist and you fix me. And that's not how it goes. This is something we're going to be managing. There's going to be times it's better. Sometimes it's going to get worse. Sometimes it's just going to look different. And so just to be real with it, it is something that you're going to constantly be having to figure out sometimes. And having support is really important. But I also think it's important to be meeting with your medical team. Like if you're going to see your for a child, a pediatrician, or your family doctor of adult, or your person, I want you to share with them what you're going through, because you need their team to help you navigate it, right? Because that's part of their job too. They're your medical home, and they might not have the exact expertise that you might need, but they should be helping you to link with those additional things. So I think that's so important. And to know we have mental health crisis right now. We have a lot of people that are struggling. And so we don't have enough providers right now. That is the truth. We do not. But that doesn't mean don't try. That means, yes, get on the wait list. And then as you're on the wait list, continue to meet with maybe that family medicine provider or that pediatrician and do regular check-ins and figure out what's free and available and while you wait. And then while you're waiting, when your appointment comes up, go, and don't just go one time, because I think the challenge is that first visit is an intake, and we ask lots of questions and we don't give you that much back. We're just getting to learn you. And so sometimes you might leave with just what we think our impressions are, or we might not even have that yet. We might have to say, we need you to come back so we can ask you more questions. And that might not feel good. You waited all this time and you didn't feel like you got anything. I want you to know, like, that's part of our process, because we're learning to get it right for you. But we need you to keep coming back. And that is the thing that I think is hard for people, is that they only come one time and they said, no, it didn't work. We didn't have time to make it work. There's a lot of things we got to do, and it's going to be us managing it together. And we got to make sure we have the right people on our team. We might have to get medication on board. We might have to do like there's lots of things we might be thinking about. We might need case management, but that might take us a while to get all those factors put together. So don't give up. Like, if you hear, sometimes I hear people say, they said this really long wait list, I'm not going to wait for that. And then they don't put their name on it. That wait list isn't going anywhere. So put your name on it. Because believe it or not, time is going faster than you think. And before you know it, that time you wish you had waited, you'll be starting over again. And I don't want you to have to start over. So those are things that I really think is important for people to know. You get that diagnosis and they offer you an appointment, I want you to go and try it and come back and ask those questions, because one and done doesn't usually work.
Well, and let me just say this, the one and done doesn't work because you are a human being. Your body is going to be changing the way, and just like we prepare for a season change, your body is preparing to support you through that season change. And one of the things that happened, and this is what I actually learned when I finally had an appointment with the psychiatrist who I have now, is that when there is a season change, sometimes your medications have to be adjusted up or down again to support you as you go through that. And when you, and again, I just have to speak for myself because I'm not a clinician, but for me, if my medication needs to be adjusted, my symptoms are the same, the way in terms of a way I'm reacting. So I have to maintain really good contact with my psychiatrist, and I can call him and talk to him. And because I have to, it's just my way of taking care of myself. So just be mindful of the fact that it is not a one and done. And I don't know about other mental illnesses. I can say just for depression, because your meds might have to be adjusted as the seasons even change. So it's like you said, it's a process.
Yeah, I think both of you all, what just keeps ringing through my ears is be patient with yourself, and don't quit, and don't give up. And it's the hardest thing. I always say one of the hardest things in the world is to navigate your world with a mental illness. And so when you're talking about clothes and sorting, I mean, these are basic household, things. And even recognizing that could be frustrating. Because it's like, I probably could fold and sort these clothes just fine if I wasn't feeling like this today.
Right.
So being patient with yourself and your provider, and, getting past the one and done, because you're right. One is literally just the intake. we just met. We haven't even had a chance to talk yet. Yeah. So.
Absolutely. And thank you for really, really pushing that out, that message, because I think it needs to be heard over and over again. It is not just a one visit and done, and there's so much more to it. So really not giving up, even when there's frustration, I think that's the most important piece of that. So thank you so much for touching on that. If I could please ask, how can schools and employers support those with mental illnesses? And what resources are available, whether or not there's a diagnosis or not?
Oh boy.
Surely some of us may even suspect something. So what can we do to help children and adults in the workplace and school and in the community?
Well, okay, let me just say this, and just by, I guess, in the interest of full disclosure, I used to, for most of the career, because I've been a lawyer now for a very long time, and most of the time that I've practiced law has been in the area of labor and employment law. And I've really become, because of that, I became very, very interested in the health of workplaces and workspaces. And so I can talk about the employer piece of it. There are certain questions that I started asking my employer clients when I would go to see them. And those questions gave me an idea or a sense as to the temperature, the atmosphere, and whether or not they were willing to even answer the questions also gave me a sense as to, okay, there's got to be a commitment here. So one of the questions that I think an employer has to ask if they are interested in supporting their employees, one of the very first questions that you have to ask yourself is, do your employees trust you? And do you trust them? And this is a whole leadership question, because if your employees do not trust you, if there is apathy, acrimony, a lot of other stuff going on in the workplace, you are not going to be able to address mental health and well-being until you first address the fact that your employees do not trust you and you don't trust them until you've got to bridge that divide. And once you have that, because people will say, well, we have an EAP program. Not downing EAP programs. I think that they are necessary and they perform and they have an important function. But again, if your employees don't trust you, if you have a long track record of just, I don't care, they ought to be glad that they have a job, then you've got to do that work if you are sincerely committed to that. If you are, and those things don't exist and those things are not problems, then I think you have to pull together all of the stakeholders in your organization and ask people what they need, ask people what they want, find out what's happening, and then begin to build it there, because so people will all have some skin in the game, some commitment to the process. So the first question is, do I trust my employees? Do my employees trust me? And am I, meaning leadership, are we willing to do the work necessary to deal with this in our workplace? Because mental illness is messy. It's not this neat 1 + 1 = 2 type of a thing. So that's what I would say.
Absolutely.
No, that's really good. I know, for the Adam board, we have a network of over 30, community providers, and our network of providers also focus on school-based prevention. And so I know Nationwide is one of our partners in that space. And so where our providers will have personnel that are either certified, licensed in prevention and behavioral health go into the different school districts. And we are in all 16 public school districts in Franklin County. So that's Columbus City and all the suburbs. And our providers are in, those different grade bands and buildings every day with curriculum on prevention, like anti-bullying and self-regulation. And I will say our youth now are so amazing. I mean, I have had some conversations with 10-year-olds that I would come out of the conversation like, when I was your age, I didn't even know to ask that question. So we know that the prevention, in that prevention space, and in how the language has been evolving over the years, and the stigma, reduction components are at work when you have, again, youth, 10-year-olds telling you what health insurance their family has, and how can, I help them find their own therapist, and and things like that. I feel like that's encouraging for our workforce coming forward, the health of our community, in the future. That whole children are the future. They really are. And honestly, in my spaces that I've been in with youth around the county in the last 2 years, I've been quite impressed. Quite impressed. So providing those, prevention services, I think, is really key to keeping at the forefront the realities of mental illness and youth. Maybe Whitney could go a little bit further, that youth are just not afraid to use certain words now. And so we hear it in our conversations, but we're all like professionals, you know what I mean? But then when youth are saying it, you're like, oh, this is really hitting home. This is great. Like work is working in this particular space. But then on the back end, it goes back to what, Whitney was sharing earlier, which is what I wrote down. Like, parents, believe your children. If they say they're not feeling a certain way, or if you notice that something just seems a little off, live, laugh, and love, don't reach out after they've been held up in their room for 2 weeks. No. If they come to you or you notice something being perceptive, please believe them and talk about what next steps could look like. So parents have to educate themselves as well. And so I'm just encouraged in the school space regarding our future with our youth.
Yeah, I love you hit on the school-based interventions, because I think it's so important to have prevention and out on our sleeves. That's like what we do. We have things specifically for schools and teachers to be able to employ in the classrooms to get those conversations started and partnerships with that kind of thing. And I'm happy to share that with the people listening to some of the ways in which we have things for schools to be using. But also, I think it's important to know that we need prevention, and then we need like intervention for those at-risk youth, that just prevention isn't enough for them. And then we need something at school for those who are a little bit more severe. And I think that takes schools partnering with community organizations so that they can be there providing those different levels of support. Because we know that prevention does great when it's there, but it's not going to be, there are going to be people who need a little bit more than that. And so if we are able to provide on the spectrum of care, and educating parents about what that spectrum of care looks like, because sometimes it might be at the school and the parents just don't have any clue that school is providing those amazing services or have those links. And so we just want to make sure that they're communicating about the partnerships they have and what can be done in the school setting. And so that's one thing I think schools could do, can continue to do and build, because I think it's a really important access. And kids are going to school, obviously it's summer, but most of the year. And so it's a great place for them to be getting that information and those resources right where they are most of the time.
Yeah, and Leandra, I can send you a link directly to our website where it has all the flyers that are school-based. We're updating them now for the new year. However, that would give, listeners, viewers, whomever, an opportunity to kind of just go through that and look for their school district and find out which one of our providers is providing prevention services at their school on a regular basis.
Yeah.
So I'll make sure you get the link to share.
I can send you also the link for NAMI. We do Ending the Silence in high schools. And there are a number of schools that NAMI is in providing that service. So I can send you the link to that.
Absolutely amazing. If you would like. Please.
All right.
Thank you so much. Thank you. This has been such an amazing, informative conversation, and time just flew by because I want to talk about this all day. It's that important. But what I would like to ask for our last question, really, we've touched on the resources available to those in need, but are there resources available for our caregivers of those with mental illnesses, whether it's children, adults? Is there any kind of respite services? Because we know that not only is this overwhelming for the individual that is living with this, it is also, it can create an overwhelming sense to family members when they're trying to help and want to be there and love and support.
Mhm. Well, NAMI Franklin County, we have different support groups. We have family to family, we have peer-based support groups, and we also have family education seminars. These are activities are geared towards, because that's what NAMI does, education, providing education and support. And so we certainly are a resource for families who are either a person who is a caregiver, or whether your child is 10 or whether they are 45. And so we do have those support services available and educational services available.
That's amazing. Absolutely. Thank you. Anyone else like to highlight any caregiver resources or just resources in general that can help pave that way to getting the help that's needed and finding the support when you need it as well, whether you have the mental illness or are caring for others?
I actually was really waiting for NAMI to answer this question because I think they do such a wonderful job, you know, at the caregiver support, family support, community support. I really feel like NAMI shines in that space. So I really appreciate, you know, Stephanie, you sharing those resources. I wrote down the Ending the Silence too, so I'm gonna look that one up.
Yeah, that's what I was going to say. I refer people all the time for that piece to NAMI. And the only other thing I say is that sometimes your child has a specific, like when we're talking about children, a specific disorder diagnosis, and there might be some national or local chapters of specific groups meeting about that disorder. But that is something like if when you're meeting with your providers, they may know something about that. So for instance, there might be people who meet just for ADHD or autism, or, you know, like, so sometimes it's diagnosis specific, so that if they're looking for something like that, that you might want to look for your like local chapters and things like that. But I often, when it talks about caregivers, you know, NAMI is a really great resource.
Yeah.
Well, look how that just circled together.
Yeah, there's one other thing that I do want to mention. So with the rollout of 988, throughout the course of the year, there's a program that comes on Wednesdays. It's an hour. It's called the 988 Crisis Jam. And we are going to be doing for next month, August, our family education seminar next month is going to be a mini crisis jam specifically directed at caregivers, older caregivers in particular, and on resilience, on self-care, and providing tools to them on how they can support themselves and find ways of doing that. So we are planning that, and anytime if we do have caregivers and family members, if there's something in particular that they want to see or have a seminar on, then, you know, we do solicit that information from them and then try to meet that need.
Amazing. Thank you so much. This has just been wonderful. Thank you again for joining us today, and to our panelists for an amazing discussion. We will be sure to post our resources that we've discussed in the chat on Facebook so that you have access to them. And I would also like to highlight that Franklin County has a free resource called Credible Mind. And this is a platform that allows Franklin County residents to access information on more than 200 mental health topics and find mental health providers in their area.
Oh, good.
So please access this important tool, as well as others highlighted in this discussion today, because it is just so important to do so. Remember, it is okay to not be okay. And it's time to start having these important conversations and begin improving our mental health and well-being. So thank you again for joining us. Take care and have a wonderful day.